Good afternoon. I'm Mark Ghaly. Good to be with you again this afternoon. I wanted to spend a little time giving you the typical update on COVID-19 and how it's progressing in the state, and then spend just a couple of minutes of your time talking about the intersection between COVID-19 and the wildfires that so much of California is facing, and all of you are watching closely. And then we'll open it up to questions as we do every week. So when it comes to the data for COVID-19, I'll remind you that Tuesday morning data at the state really reflects cases reported from Sunday early morning to Monday early morning, and then we report them on Tuesday. So again, reflects Sunday case numbers. And that's why you see what is a lower than normal 4,480 number in terms of total cases. But I remind you that we look more closely to the 5,775 number that we're reporting today as the statewide 7-day average. We've done 110,000 tests in the last 24 hours, or I should say that's the number of tests that we have reported out. The state's test positivity, again, the aggregate number, is 5.7% over 7 days and 6.3% over 14 days. Both of those numbers down compared to what it had been 14 days ago, 28 days ago, 2 months ago. We've seen that number continue to trend down since we cautioned everyone about the increasing case numbers that we saw across our state. I will caution you again that those are statewide numbers. And as the governor reminds us, California doesn't live in the aggregate. We're a big 58 county state, 40 million people big, and different parts of the state have different struggles and challenges with COVID-19 compared to others. We also are reporting, sadly, another 105 deaths in California. Again, those are reported. They aren't necessarily deaths that happened just yesterday. Hospitals sometimes take a little time to report up the deaths because they want to make sure that there's a complete information about all of the demographics associated with the person who did die. Our 7-day average for deaths in California as it relates to COVID-19 is 131. I will remind you also, we've been watching for 2 to 3 weeks steady declines in our hospital numbers and our ICU numbers. Today, our hospital number of 4,424 individuals in the state's hospitals is down about 19% compared to where we were 2 weeks ago. And our ICU number of 1,388 people with COVID-19 in our ICU beds across the state is down about 18%. So all in all, these are numbers that continue to show stabilization of COVID-19 transmission in our communities, and its impact on our hospitals is improving. However, as we talked about last week, the confluence coming together of flu in the fall and winter with COVID-19 now continues to keep us vigilant and working hard to make sure our systems are ready and that all of our messaging is out there for people to follow and to think through so that we make sure we protect ourselves, our families, and our community as we take and prepare for flu and COVID coming together later this year. I want to take another moment to talk about what another sort of two-headed issue for California looks like, and that is COVID-19 in the setting of wildfire season in California. So it's been about 3 months when our Department of Social Services and Cal OES came together and made plans for what it would look like to have wildfire season with COVID-19 in the backdrop. What does it mean to operate a shelter with physical distancing? What does it mean to put an evacuation order out to people who have largely been staying at home and trying to keep less social activities and social and physical distancing? So over the past couple of weeks, as we've faced wildfires of really large proportions, many communities either had a fire or are experiencing one now. and up to many thousands of people have been evacuated. Currently, 136,000 Californians are under an evacuation order in many parts of the state. Of that 136,000 individuals, 3,383 as of this morning were living in shelters, both two types of shelters. We often talk about general shelters. These are congregate shelters, individuals who live in large facilities for a number of days with their families, near neighbors, near people who've also been evacuated. And in the past, that is cot lined up next to cot, maybe some areas for families, often lines of buffet style meals, shared bathroom and showering areas. All of these things were sort of shelters of old. But as we continue to work with the state agencies, the Red Cross, a number of our county partners who really have that responsibility on setting up shelters, the congregate shelters of old look very different today because of the planning efforts that have been put in place. What do I mean specifically? The governor raised some of these points, but I'll drive them home once again. Anyone who's either a resident of a shelter for a period of time, a worker, somebody who's there touring and bringing supplies, everyone goes through rigorous screening checks, temperature checks, making sure that they don't have symptoms consistent with COVID-19. We're sure we've provided shelters with ample supplies in terms of PPE, mainly masks, so that everybody can keep a mask on. Cots that used to be pretty close to one another are at least 6 feet apart. Food is not delivered buffet style, lines up of people getting food at a station, but rather delivered to where the person is staying and sleeping. Families might enjoy a tent structure within the shelter so that they can be together in their sort of natural family cohort. As well, that if we identify somebody who might develop symptoms consistent with COVID-19, we have the capacity working with our local public health partners, who again have that responsibility and do a fantastic job of managing and setting up the shelters to look out for infection control protocols and ensuring that anybody with symptoms is identified, exposures are tracked. And the good news is we have a clear sense of who's been in and who's been out of the shelter, when they were there and when they left, so that if somebody is exposed, we can deliver that information and make sure that appropriate quarantine, testing, and potential isolation do occur so we reduce transmission. We've made a lot of gains in the past many weeks as a state, and we knew wildfires would stretch us and test us again, and we put these precautions in place to make sure we're prepared. I wanted to spend a few more minutes talking about a couple of other issues that around the nexus or the intersection between COVID-19 and fires as well. So yesterday's press conference, one of the reporters asked a very smart question about what are our mask protocols and recommendations. We know that people are used to wearing masks during wildfires, that the smoke inhalation is dangerous. It's not great for anyone's health, but in particular, those with underlying respiratory conditions like asthma or COPD, or even heart conditions. And we want to make sure that individuals who have those conditions are as safe and healthy as possible. So our recommendation is for COVID-19, continue to use your face covering, either a cloth face covering or a surgical mask. For those who are out in near the fires, an N95 mask may be the appropriate mask for you to wear. And those are provided to many counties, many individuals, and at all of our shelters. For wildfire, we know that face coverings are not sufficient. They do not block enough of the smoke, and it does not protect you, or certainly does not give sufficient protection around wildfire smoke and smoke inhalation. So our advice to those people in affected areas are stay home as much as you can. Keep your doors closed and your windows shut. If you need the air condition, use it prudently. And if you're able to wear your face covering, if you're with friends and family that you haven't been with in quite some time, we recommend that as well. If you have any concerns, we advise that you reach out to your treating physician, ask for advice in whether any of these precautions should be changed for your individual situation. I want to return to evacuations. We said 136,000 evacuees currently in California, and only just over 3,000 of those are in either congregate shelters, the ones I just described, or largely our preference today is moving many into what we're saying are non-congregate shelters, or really hotel rooms, allowing people to have their own space, have their own ability to keep up with the physical distancing and other COVID-19 precautions that help us reduce transmission. We have well over 1,000 individuals across the state in hotel rooms as a solution to shelters, because our preference is to make sure we use these non-congregate hotel rooms even ahead of some of the more congregate open shelters that we're used to in the past. But for those 133,000 evacuees who are likely out of their home, maybe for the first time in many, many months, or certainly for the first time this far away from home, they may be staying with friends and family, loved ones that they haven't seen in weeks or months. They may, because of the stress of COVID-19, the concern around the fires, reach out, give that loved one a handshake or a hug. And I want you at this moment to remember all of the things we've been talking about for the last many weeks and months, that this is no time to put down our guard. It's a top priority to make sure evacuations are done safely and in accordance to guidance. But if you are staying with a family member or a friend who you haven't seen in some time, follow as many of our precautions that we've been talking about as you possibly can. That means if you can have your own space, a room, a bathroom to yourself or for your family, try to secure that. If you can wear your face covering, even when you're indoors, when you're mixing with people you haven't seen in a while, that will also help us reduce transmission. Make sure you follow really great hand hygiene, washing your hands often for the specified amount of time with soap and water, making sure you don't share utensils, food serving plates, and other things, so that we minimize transmission as much as we can. We know this is a stressful and hard time for many Californians. We are with you, supporting both local partners and you as individuals, and we want to make sure we deliver this guidance so that we keep our guard up. And as we exit, this current fire situation, that we don't then find that our guard came down and we see a number of new infections in our communities. I know a number of counties are asking us about any change to our orders, especially as we've had outdoor dining prioritized, whether that can even temporarily move indoors. Currently, we're talking to a lot of counties about that, and we believe that if we can have families and individuals stay home if they're not under evacuation orders and order food for pickup or delivery, that's another great way to meet the needs of your family and your own self, but also supporting those restaurants throughout your communities. I also just wanted to take a moment to talk particularly about vulnerable populations. We've been talking through for months, ever since the beginning, about protecting our seniors, protecting those with underlying health conditions, with functional needs. And now we're telling many folks who haven't left their homes for months, who are worried about exposure to COVID, that it's safer to leave than to stay. And that direction is indeed true. That the risk of fire is a temporary one, albeit a very serious one. We can mitigate the COVID-19 risks with your cooperation and as communities. So please heed to those directions to evacuate. Ask questions about how we can reduce your risk. If you end up staying with a family or friend, please follow all of the directions that I've outlined here and we've been outlining for months. And rest assured that we've put in a number of COVID-19 safety precautions in all of the shelters. And if we're able to identify a hotel where you can still have the support that you need, that would certainly be preferable. If you have any questions about these issues as it relates to wildfires, evacuations, how to stay safe, how to get resources, I want to remind you of our COVID-19 general hotline that also has information about how to access services and resources as it relates to evacuations and fires. That number, I'll say it twice, is 1-833-422-4255. Again, 1-833-422-4255. Before opening it up for questions, I just want to say that this is indeed a difficult time in California. We knew something like this would come because wildfires around now, or really a little further down in the year, this is a bit earlier, are expected, and that the COVID-19 challenges for the state have been with us and continue to be with us as we work towards treatments and vaccines, that this would come together. But the reality of it is challenging for so many Californians. And we just at the state, a deep gratitude to all of you Californians who are impacted to help us continue to do things for the safety of yourselves, your families, and communities, and to our local public health, social service partners who are, up all night trying to create the safest environments for the Californians who are impacted, to the thousands of volunteers who've donated their time or resources to help. I mean, just a deep gratitude. And although these challenges are so important, California consistently and constantly comes through because of the efforts of us as individuals. And just as we came together 40 million strong to bend the curve of COVID once, we're starting to see it happen again, and that we do it again with this new set of conditions with wildfires. And as we enter in weeks and months where additional challenges come our way, the resolve and resilience of Californians cannot be overstated. I'm proud to be one of you and look forward to continuing to work to keep our counties and our cities as safe as they can be. So with that, I'll open it up to questions.
Kathleen Renane, AP.
Hi, Dr. Ghaly. So earlier in the summer, you spoke about how when the state originally began reopening, people were focused too much on the when and not enough on the how, and we sort of saw the effects of that. So I wonder now, as the state prepares to release reopening guidelines again, what lessons have you taken since the first round of reopening that we're now applying to these new guidelines we're preparing? And beyond that, similar to schools, will counties have to be off the list for 14 days before they can reopen businesses under the new guidelines that will be coming out?
Yeah, Kathleen, thanks for the questions. Nice to hear from you. Certainly one of the big lessons that we have learned is that our role as individuals and people, communities, plays a major role in transmission. As we talk to county health officers, over and over different parts of the state, we hear about transmission, the impact of what some people say are family gatherings, these private gatherings that happen throughout the state. Many of us meet up with a friend once or twice, see an aunt or an uncle once or twice, and our guard comes down. And this sneaky virus that we call COVID-19 doesn't take a rest. It will find every opportunity to transmit from person to person, because that's what germs do. It's no surprise. So as we continue to beat the drum and think about the new guidelines that will be coming out later this week, that is definitely going to be a theme, that our role of individual, I call it the sector, as we talk about sectors, the sector of personal responsibility, that there's really a great amount of good we can do by choosing things like wear our masks, stay physically distanced when possible, keeping things outdoors. So that will be not just reflected in what we hope to deliver in terms of messages to individuals, but also really encapsulated more in our sectors as well. And some of those themes will be certainly primarily there. We also know that it's important to continue to watch how changes manifest in communities and in the data, that sometimes moving sooner than you get a clear indication doesn't allow you to think through how some of those changes have impacted you and should be a clear part of your decision making. So those are some themes that you'll hear coming in later this week when we announce the changes that we're putting in place. As we've said yesterday, the impact on schools is going to be really no impact. The plan that we've laid out is going to continue. So districts and counties who've been thinking through and timing activities around when they might come off should not be impacted in any way. And I'll let the governor share a lot more about the details of what this new plan looks like as it relates to some of the other parts of your question, Kathleen. But again, thanks for the question.
Ana Ibarra, Cal Matters.
Hi, Dr. Ghaly. Yesterday, the governor said 11 state labs had been impacted by wildfires, and I was wondering if you can share a bit about what that means. Is that because they're in evacuation areas and currently not processing test results? I'm wondering does that mean we may see more backlogs in those areas? So just wondering if you can expand on what that means for testing and the numbers the state reports out.
Yeah, so let me clarify, and I heard the governor say labs as well. Really, these are the state testing sites. So we've been talking to you about over 100, nearly 120 state testing sites that have been set up throughout parts of California, both urban and rural, throughout many of our counties to really help facilitate collection of COVID-19 sites. Those sometimes are outdoors, drive-ups. They can be done in mobile ways. And we knew that both the coming together of extreme heat in some parts of the state, as well as smoke and fire impact, would either close sites down temporarily or cause their hours of operations to change. The good news is we have fewer reported operational impacts today than we did in prior days. And that collection is key to make sure that we get the samples sent, but it does not impact lab turnaround time. That said, it is important to know that some people who expected to have an appointment at a testing collecting site on one day might have had that appointment canceled. And so in that way, we know we're working with our partners to make sure anybody who's been impacted gets rescheduled and in fact gets access to the site. We hope because of the conditions nationally and within California that test turnaround time is not impacted by the wildfires in any way. And we know that having California create really independence so that California's testing needs are met through California solutions is part of what the state testing sites helped us do, and our ongoing work with labs and lab vendors to make sure that tests get processed in a timely way so people have both immediate and actionable information so they know whether they're sick or whether they're infected or not, and whether family members are exposed.
Angela Hart, Rising Up News.
Hey, Secretary Ghaly, thanks for taking the question. Has the administration or the agency done any modeling or has seen any evidence yet about whether the wildfire challenges have driven up or could potentially drive up the rate of infection in areas, especially those that are hard hit? Any anticipating of that challenge ahead?
Yeah, Angela, really excellent question. And we've absolutely been thinking about it. It is hard to tell. I mean, we've learned and continue to learn that any activities or actions that increase mixing among people who haven't been together in quite some time creates a transmission risk. We worked early to put into place precautions and shelters, communicating with communities that were vulnerable to wildfires to say, look, we have to keep our guard up. The fires are an important and major challenge, but in the context of COVID, we need to make sure that we do certain things differently. And we believe that those things have largely been in place and followed. And that will reduce the overall risk of transmission. But I won't be the first to be surprised if we have some increase in transmission in those areas because we're experiencing different conditions today. We stand ready to work with our counties, with those health officers who are tracking this closely, understanding any early trends in the data so that we can be prepared for what might be added need for contact tracing support, disease investigation, additional isolation resources, as well as the potential impact on hospitals and ICUs, so we can stay out in front of it. But it's an excellent question, something we've been thinking about. And I wouldn't say that there's a clear model that points us in the direction, but just the threat and the concern alone has really increased our planning around this issue.
Claudia Casciuto, KNX.
Hi, thanks for taking the question. So the county has just seen its 14-day case rate drop below 200 per 100,000. So I'm wondering if you can talk about what assurances parents, teachers, other school workers might have that hitting the state's benchmark now means it's safe to return to campus.
I'm sorry, can you say which county it was?
County, Los Angeles.
LA County, thank you. Couldn't hear the beginning part of the question. You know, I think you raise another important issue that should be reminded, we should remind people of, that in our school guidance, although our county monitoring list is pegged to a threshold of 100 cases per 100,000 over 14 days, we created a waiver process for districts to work with their county health officers in their communities to bring our youngest students back to on-campus learning sooner when those counties are between 100 and 200 cases per 100,000 population over 14 days. And so the question is really, is that a potential option in Los Angeles? I will say, as a resident of Los Angeles County and a longtime former employee, I trust their ability to make good decisions with their local school districts to understand those conditions. I know that Dr. Ferrer and her entire team at the Department of Public Health is thinking about this closely. And indeed, to the heart of your question, that these decisions will only be made when together the school districts that are all the teaching professionals, teachers, other staff at schools, as well as parents and children and other local community groups come together with the commitment from the local health officer to track transmission closely as we begin to consider bringing students back. And that is a decision that is a local one. The state stands ready to assist on any of the questions and issues that come up to support each of those districts to make the best choice that they see fit for their communities.
Brady West, LA Blue.
Hey, Dr. Ghaly, thank you for taking my question. Dr. Ghaly, when you and I spoke last, we talked about your commitment to supporting school districts across the state of California in addressing mental health challenges, particularly for students in disadvantaged communities or at-risk populations, such as the LGBTQI population. My question to you today, there are plenty of school districts within the entire state of California. Would you be, that aren't that affirming and aren't working towards that goal, would you be willing to partner with, say, the Trevor Project, which has experienced literally a doubling of calls to its assistance line for LGBTQI youth, and maybe getting the word spread out further by utilizing the resources of the state of California versus them relying it to local districts, keeping in mind that districts like the LA Unified do a marvelous job already, but there are districts that don't.
Yeah, I think it really is an excellent question. And my interest, as well as all of those I have the privilege of working with both at the state and county level, care deeply at trying to do as much as we possibly can, especially at this moment. So personally, and sort of as a member of our broader team, looking at opportunities that will help us advance the message, increase access to resources that we know make a difference will be important. I know my team is familiar with so many of the various resources out there, and we do have an openness and willingness to partner as far as we can, and often look to bring counties and local partners together with our nonprofit partners that are doing incredible work throughout the state. And so if those connections are helpful, we're happy to make those. Also constantly thinking about how we increase the resources both that we receive from the federal government, the state resources, and how they impact young people's total learning needs, including behavioral health needs, is not only a priority of the state, but a personal priority of mine and a very important one for the governor, our Surgeon General, and many others in state leadership roles. So we look forward to advancing those. None of these solutions comes together overnight. They often come with a lot of sweat and tears, but they are the ones that have the greatest impact. So during this time, as we start building those partnerships up, I look forward to months and in the future reporting how we use the opportunity around COVID-19 wildfires to really increase and accelerate the change and improvement to services to vulnerable kids across our state.
Victoria Californ, Politico.
Hi, Dr. Ghaly. Thanks for taking my question. I'd like to ask about contact tracing. It seems like the efforts have become more difficult as we know more about disease, longer incubation periods, these wide-ranging symptoms, mistrust in the community. Also, we have a pretty diverse state. I'd like to ask and wonder if the state has changed its focus on contact tracing at all as we learn more about the disease. Is there anything different that we're doing when it comes to contact tracing?
Yeah, I mean, really, thank you for the question. Excellent question. Contact tracing is a tried and true public health resource and tool. It's not something that we sort of brought together just for COVID. Counties have been doing this for decades. Internationally, this is a key tool from everything from HIV to tuberculosis to how other countries have really controlled the pandemic in their own backyards. So again, the state and our local partners in no way are turning our back or considering a shift from a contact tracing focus. I think when we had such high levels of transmission and our resources for contact tracing were not adequate, we've been working to bring those as the case numbers come down and contact tracing and disease investigation resources come up. We're looking forward to that equilibrium point where we can begin to feel confident that we're tracking and able to trace and have conversations with individuals who are all individuals infected across the state. Now that takes a great deal of commitment at the local level. This is really a responsibility, something that I know my public health colleagues take very serious as their responsibility at the local level. The state has augmented with both resources and information technology tools to make that job a little bit easier so that the information can be organized, contacts are streamlined, and communication is a little bit better. But it's still a tall task for any county when you have high levels of transmission. That said, as we see those transmission rates come down, we believe that the resources at the county level, including both fiscal and human capital resources from the state, will allow counties to do more and more, quote, contact tracing and disease investigation in that tried and true public health way. At this moment, we are working with counties and really looking at what I like to call targeted contact tracing, really understanding where we might have big factories or large other areas where we expect to see transmission, and we really try to use contact tracing as an early tool to control outbreaks and spread in, let's say, a meat packing factory in the Central Valley or a textile factory in Los Angeles County. I think these are efforts that will prove to be successful and help us prevent larger surges in the future. And we know that it is something that will continue to take work on our county's parts, and we continue to support them as much as we possibly can.
Hi, Dr. Ghaly. Thanks for taking my question. I'm wondering if you can offer any insight into how or if Labor Day is being factored into the discussions with local officials about updating reopening guidelines, since we saw previous spikes in part connected to past holiday weekend.
Yeah, I mean, I think, thank you for really the excellent question. So much of the messaging around Labor Day needs to come out now, and that's why we talked a little bit, just as I mentioned in wildfires, that you may be getting together with people you hadn't seen in a while, and this whole notion of the sector of personal responsibility and the need to really be thoughtful about how you interact with those you haven't seen in some time, either in a planned or unplanned way. That Labor Day is yet another incredible moment in California and across the country where we celebrate something, but really the idea of celebrating, as we promoted over Memorial Day and the 4th of July, in a really lower risk way. So that is, the messaging there is really critical and vital. And I implore all of you who control the pen and the press to really help deliver some of those messages as well, because I think they're key. And the more we share them, I think the more sticky and sticky they become. In terms of how that impacts our framework that we'll be talking about later this week, it doesn't have a direct impact, I would say, but it's certainly moments like Labor Day and other holidays are all built in to our understanding of disease transmission, the need to be patient as we watch. Moments like Labor Day actually have impact in cases and in hospitalizations, and that this overall sense that really giving time for potential increases in transmission to show up in the data so we don't make decisions in any premature way.
Final question, Cynthia Below.
Hi, Dr. Ghaly. You talked quite a bit about the overall COVID infection rates and how those are stabilizing or improving. I'm wondering if you can also speak to, as we've learned more about this disease, are patient outcomes improving at all, or have hospitals, been learning more about this disease, and have they been able to find better and more effective treatment?
Sophia, thanks for the question. I think one of the things, and we talked about it early on, and I really appreciate chances to emphasize it again, is that we did the stay-at-home order originally to buy us time to prepare. And that preparedness was not just around PPE and masks and hospital beds, but it was about learning from others. And the literature is rich in the medical community around experience of taking care of people in Wuhan, experiences out of New York and Spain and New Jersey and Massachusetts. And we've learned quite a bit. And as I talk to my clinical colleagues across the state, whether they work in emergency rooms or clinics or in intensive care units, we've learned quite a bit about how to use respiratory support. Early on, we talked about the need for ventilators, and indeed they are an important tool in helping support people with COVID-19. But we learned over the last few months that having somebody on a ventilator early may not actually be the most effective way to get them through their COVID-19 battle, that providing other types of respiratory support, that positioning when somebody's intubated on a ventilator in the intensive care unit can also drive better outcomes. So all of those, I would say, not so much trade secrets, but practice patterns that have become more and more well understood across the globe have really penetrated how we've managed in California. Also, just the use of things like remdesivir, a drug, a medication that really has come out as one of the few tools that we have to improve outcomes for those who are hospitalized, shortening their course of stay, allowing them to get out of the hospital sooner. Some clinics and hospitals have used increased numbers of home oxygen therapy so that people could be discharged sooner, creating both capacity in the hospitals, but also reducing someone's risk of getting a different infection while they're in a hospital, which is not uncommon. So we have learned quite a bit, and we use every day and every week and every month to learn a little more, so that as we seek improved treatments, as we learn better how to take care of the sickest, how we develop tools to prevent transmission, we can incorporate all of those in our planning and our messaging as we await the development of a vaccine and hopefully the widespread use in California, so we get through COVID, this pandemic period, and we learn to live with COVID-19 just as we have, like with the flu and other infectious diseases, for years and decades to come. So again, I appreciate a chance to answer as many questions as I receive. And I just want to say, just as a final note, again, reiterate the appreciation to our first responders, people from all across the globe, firefighters who've come across seas, across rivers, multiple state lines to help us in California. I know our citizens and our leaders are all grateful for what you've done. And for those local heroes that do the work, not just today and over the last couple of weeks, but every day, just a deep, deep gratitude to all of you, and look forward to seeing you soon.